just 3 days, cannabis will be legal right across Canada, not just for medicinal use, but for whatever use you may have for it. You can smoke it, drink it, eat it, consume it just about any way you like. But how is it all going to work? Well, we've invited Canadians, all with a serious stake in this issue, to ask their questions. Some of them joining us here in studio, some will hear by video, and to answer those questions, we have joining us our esteemed panel, Bill Blair, Federal Minister of Border Security and Organized Crime Reduction. He's been the government's lead on the cannabis file. Thanks so much for being here.
Thank you, Andrew.
Dr. Gigi Osler, head of the Canadian Medical Association. Gigi, Dr. Osler, which do you prefer?
Gigi is fine.
Gigi's fine, okay. And we have lawyer Kirk Tousaw, who's also a consultant for Canopy Growth. Kirk, I can call you Kirk, that's
Absolutely.
Okay?
Thanks,
all right,
Andrew.
We'll keep things conversational. And that is, of course, one of the world's largest cannabis companies. So thank you to the three of you for being here. Now, I do want to be clear. This isn't a debate about whether legalization is the right thing to do. It is happening, period. And most Canadians support that. Indeed, the folks asking questions tonight do too, but there are questions. So let's try to understand all of this a little bit better. Let's get started. Take a look.
My name is Elaine Farrell. I have been working for the Toronto Transit Commission close to 27 years. And I am fighting for the rights to use cannabis CBD oil for the chronic pain that I have. I have bilateral sciatica in both legs. I have herniated disc in my lower back, 2 of them, and 1 in my neck. So I went on CBD oil for 2.5 months, and the difference was tremendous.
Elaine, thanks for being here. What's your question?
How will the workers' rights be balanced and my rights to be able to use cannabis either for medicinal or recreational?
Right. And so, Minister Blair, this is, I think, perhaps an appropriate question for you, because I suppose on the medicinal side, employers do have an obligation to accommodate their employees, as in any medical situation.
In fact, in Canada, we've had experience with medical cannabis for almost 2 decades in this country. And employers are working, I think, very diligently right now to ensure that we strike the appropriate balance between the right of their employers to have appropriate medical treatments and a safe workplace.
So on the recreational side of things, though, that's where it gets a little bit murkier. I mean, what is the framework there?
So for people who are in a safety-sensitive position, there are likely to be developed rules regarding cannabis use and fitness for the work that they are required to perform. You know, there's been a lot of research on this and a lot of work done, but I think more needs to be done. And we're hearing, just last week, a number of police services and the Canadian Forces have come out with new regulations with respect to that issue as well.
Except, I mean, what's noteworthy about that is in a way, it seems like different workplaces are scrambling in different ways, and the differences are stark just when we talk about police forces. So Calgary Police will not be allowed to use cannabis at all, not even when off duty. Toronto Police won't be permitted to use cannabis within 28 days of reporting for duty. West Vancouver Police restricting cannabis to within 24 hours of a shift. In Saskatchewan, there's no time limit at all, so long as you are fit for duty when you report to work. This seems like a bit of a patchwork series of solutions and quite confusing.
Well, I think a number of chiefs are being quite cautious. The standard that has been in place for over a century for police officers is they have to be fit for duty. Frankly, it's a fairly straightforward determination for those who might be under the influence of alcohol, for example. But, you know, the familiarity with cannabis impairment among law enforcement officials is perhaps not as developed. But I think those positions will evolve over time based on the evidence.
Kirk, does an employer have the right to reach into a person's personal life and say, you know, it's one thing to say you can't consume cannabis while you're here at work, but you also can't do it at home?
I don't think they should have that right. I mean, at the end of the day, this is going to be a legal substance to consume for recreational or any purpose that you wish. And the concern I have is that a lot of employers may rely on drug testing to determine impairment. And drug testing for cannabis in particular is a difficult subject because cannabis metabolizes into your fat and is stored by your body for a tremendously long period of time, weeks or over a month. And so when you're testing people for the presence of these metabolites, you're not really getting a clear picture of whether they were, to use Minister Blair's words, fit for the job, fit for duty.
What is considered impairment at work, and who decides that for the workers?
Well, it's interesting. You know, Minister Blair said something about alcohol and said essentially it's pretty easy to tell if somebody's not fit for duty when it comes to alcohol. And that's because alcohol produces significant impairing effects. Cannabis, particularly for people that use it on a chronic basis for medical conditions, I have for the last 17 years for chronic pain, very difficult to tell if somebody's, quote unquote, impaired by cannabis, even though they might be under the influence of it.
Does the research shed any light on this? Because, Kirk, as you point out, I mean, THC can stay in the body for an awful long time.
I think the research is very varied. And I agree with Minister Blair that more research will help to shed a light on impairment and usage and help reduce some of the discomfort that employers may be feeling.
Now, our next question is on the same theme of using cannabis responsibly, let's say. And to set the stage, consider this recent study by CAA South Central Ontario. Now, they surveyed 1,000 people over 19 who drive and asked if they've ever driven under the influence of marijuana. And you know how many people said yes? Almost half. More than a quarter also said they'd driven under the influence of both alcohol and cannabis in the last 3 months. Michael Stewart joining us now with our next question. Hi, Michael.
Hi, thank you for having me. For 30 years, Arrive Alive, Drive Sober and the Ontario Students Against Impaired Driving have worked tirelessly to prevent impaired driving in Canada. And one of the challenges I continue to see is talking to young and novice drivers about how they feel that driving while impaired by cannabis is perfectly fine and doesn't negatively affect their driving ability. How can we convince these young and novice drivers that driving while impaired by cannabis, it can be dangerous?
Gigi, I'd like to start with you if I could. I mean, what to tell someone who, and there may be two types of people there, right? Mm-hmm. Either the person who thinks that their ability to drive isn't impaired, isn't hindered by the use of marijuana, or people who think they drive better when they consume cannabis because they're calmer or less aggressive. What would you say to those people?
You brought up the use of cannabis and alcohol together, and that's a real concern because now you've got folks who are able to use two substances legally that will have effects on their ability to drive. And I've seen some studies that have shown that if you use cannabis and alcohol at the same time, you're 11 times more likely to die in a car accident. And so I think for Canadians, if they choose to use, make sure they choose wisely. And in particularly, if they have not used before, be very careful about what they use, how much they use, and then best not to drive if you're not sure how you're going to react to it.
Minister Blair, what would you say about limits and about testing?
Well, we've had a significant issue with impaired by drug driving in this country for over a century. This has been a crime in Canada since 1925. But up until recently, the police did not have adequate training. They did not necessarily have the authorities they required. And they did not have access to the technology that will enable them to detect and therefore deter. And so I would like to ensure that young people in particular, but all drivers in Canada know, first of all, that this is a drug that does impair, and your ability to operate that motor vehicle is compromised. And now there are real consequences because perhaps for the first time, the police are going to have the ability to uphold that law.
But Kirk, you're a lawyer. I mean, tell me what you think about how this will go out, especially in the vein of the reliability of the testing and how that will work.
Yeah, I want to say first, the most important way we can deter impaired driving of any kind is with public awareness and education. So I commend you for that campaign. I don't think enforcement has proven to be a significant driver in reducing the use of any substance that might impair your ability to drive. I think it's been an education campaign. In that vein, I think an over-reliance on enforcement pushes us towards unreliable testing methodology and frankly arbitrary rules that have been put in place with respect to this issue. And in particular, our country now has a per se nanogram per milliliter limit of THC metabolite in your system over which you're presumed to be impaired while driving. There's no science that supports that nanogram per milliliter limit. It's essentially made up out of whole cloth, and it'll criminalize.
You foresee court challenges on this front?
Oh, there'll definitely be court challenges. If you're a medical consumer that consumes for a chronic condition, you are always over that limit. I'm over that limit sitting here right here today. I'll let your viewers judge whether I'm impaired or not at the end of the program. But the fact of the matter is the testing is invasive, it's unnecessary, and it actually takes away from the ability of police to do their job, which they've actually done, I think, historically, pretty well. They use their discretion. If you're driving badly, they observe your bad driving behavior. They come to a conclusion as to whether or not you're impaired by any substance, be it alcohol, cannabis, or anything else. And most times in this country, they make an administrative decision to take you off the road. to the point of impairment generally, certainly the potentiating effects of alcohol impairment by also using cannabis are something we need to be concerned about. And we do need to, in particular, be concerned about, I'm not so sure, young drivers or novice drivers. I think novice cannabis consumers. If this is one of your first times using cannabis and you're using a high-potency cannabis, you know, be smart, be responsible. And I think we trust Canadians in a whole variety of ways to be responsible about their own individual behaviors. If you're somebody that's been using cannabis like I have for more than 30 years on a regular basis, those impairing effects, if existent, are exceedingly minor. And I think there's quite a differentiation there, and we need to be sensitive to that.
Michael, thank you very much for your question. Our next question, this is from Signe in British Columbia. Watch this.
My name is Signe Knudsen. I'm an artist and a mom. I'm also a medicinal and recreational cannabis user. What I want to know is, once cannabis is legalized, what are the parental liabilities if a teenager accesses it at home? Also, wouldn't it be safer, if kids are going to use it anyway, for a teen to access it at home from a parent instead of illegally somewhere else?
Okay, Kirk, I think this is one for you. And we'll start with the first part of her question, which was, I suppose, the legal consequences of a child, a teenager, getting into their parents' stash.
Well, I'm a parent of 4. I've got kids ranging from 8 to 18 years of age. So it's a question that I've thought about. I also have cannabis in my home because I'm a cannabis consumer and have been for 32 years. I think there's a way we deal with this in society right now with respect to alcohol. And we don't impose some sort of arbitrary restrictions on parental conduct. We don't criminalize parents who have alcohol. We don't require parents to put locks on their alcohol cabinets, even though consumption of alcohol, we know, leads to death or serious danger to
So fair point. It's hard to imagine a scenario where you could accidentally do 8 shots of tequila. But I think...
Is it?
I think you might notice on the first shot.
There are young people consuming too much alcohol on a daily basis.
So that's fair. However, what I would say is it's much easier for me to imagine a scenario where a teenager might accidentally ingest a pot brownie or a gummy bear that's infused with cannabis and not even realize it in that moment, and only realize it minutes, hours down the line.
I think this, and I'm putting my parent hat on right now, I think this is an opportunity for parents to start having conversations with their children about cannabis use and how to use it safely and wisely. In terms of accidental ingestion for children, one recommendation may be to treat it like a prescription medication or treat it like alcohol. Keep it out of the reach of young children in particular. Because young children, let's say it is an edible, and they think it's a gummy or they think it's a brownie, and whatever amount they ingest may be just simply too much for their smaller bodies.
Minister Blair, I mean, just while we're on the subject of age and youth consuming cannabis, just as I listened to Dr. Osler's response there, it strikes me that her organization, the Canadian Medical Association, has recommended 21 as a legal age to consume cannabis. The federal government has gone with 18. Why not go with the CMA recommendation of 21?
It is the jurisdiction of the province to determine the age limit. We've set as a minimum the age of 18, but it's told each of the provinces that they can go higher, and most have, in fact, gone to 19. One is talking about going to 21. It really comes down to, at what age does a Canadian adult have the right and ability to make decisions for their own health? But it's an adult choice. But for children, our first responsibility is the protection of children. And I just wanted to clear up something that the lady who spoke earlier, when she talked about, isn't it better to give the drug to your kids if they're going to use it anyway? I want to be really clear. No, it's not. And the law is clear that it is an offense. It'll be an offense under these regulations and the law to give cannabis or to sell cannabis to a person under the age of 18.
But criminalizing parents for providing cannabis to their teenagers in the home is an absolute horror show and a mistake. We don't do it for alcohol, and we know people can die from consuming alcohol. So we should not be doing it for cannabis. That was a miss by the federal government. It prevents exactly what we should be encouraging, which is conversations between parents and kids on a real level, not some artificial level dictated by government.
I don't know if we're going to reach agreement on that point on this panel here today.
We won't.
One of the things that has followed people who consume cannabis is the stigma around it, certainly. Have a look at this. In a poll commissioned exclusively for CBC News, 36% of those asked believe that there will be less stigma around pot usage. That seems likely, especially given the industry that is building around cannabis, which leads us to our next question. We have Ronan Levy joining us in studio. Hi, Ronan. How are you?
I'm well. How are you?
Good, good, good. What's your question?
There's an incredible amount of innovation going on in the cannabis industry in Canada right now, and I think most observers would agree that innovation is going to be essential to help the government achieve its policy objectives of protecting the health of Canadians and Canadian youth, as well as eliminating the black market. However, regulators tend to be slow to react to innovation and technological change. So my question, primarily pointed at you, Mr. Blair, is what is the government going to do to foster innovation in the industry to ensure that the policy objectives are reached?
And is it fair to say that when you talk about innovation, edibles is one key area?
Edibles is one area, absolutely, but there are a number of different consumption methodologies, edibles being one. Different novel cannabinoids are being developed. There's an incredible amount of work happening.
And Minister Blair, edibles not coming online within the legal framework until 2019.
No, what we said is that 12 months after the date of implementation, which was 12 months from October 17th, that we'll bring forward regulations for edibles. And it was a recognition that there were some significant additional risks in the edible market that needed to be properly regulated. And we based that determination on the experience in other jurisdictions that urged us to approach that with caution, but to do a very careful examination to make sure that it can be done safely.
Why couldn't all of this have been sorted out before, though?
Frankly, because of its complexity. And Health Canada, we've been working pretty diligently for the last 2.5 years to develop two significant regulatory frameworks. One is for the production of cannabis and the licensing of licensed producers. We've also been working with the provinces and territories in the development of their regulations. And there are additional regulations with respect to such things as marketing and advertising, packaging, and promotion, which have also been put in place.
Let's hurry up and get legal edible cannabis products onto the marketplace so that they're labeled, so that they're packaged appropriately, and so that they're clearly visible as having cannabis in them. Right now, we're going to say to Canadians, you're allowed to possess cannabis. You're even allowed to make your own edible products at home, which is probably the worst scenario because difficult to do dosage at home. It's not labeled, it's not packaged.
I think this has been, considering the complexity of the issue that we were dealing with, a pretty dynamic environment of regulatory development in this country. But we have, I think, been also appropriately cautious because we recognize we have a response. It's a significant change. We have a responsibility to maintain a healthful environment.
Except, I mean, it does occur to me that in taking the cautious approach, we are in a bit of a sticky, problematic situation where I think of a Deloitte survey where I think it was 6 out of 10 Canadians would choose edibles as their preferred method of consumption over any other method. And yet the only way for anyone, as of the legalization date, to legally get edibles, either you have to buy it illegally on the black market or you have to make it on your own.
I think we have to very, very quickly get the preferred formats for people out on the marketplace, that being edibles, concentrates, vape pens, and then within the edible subcategory, Minister Blair mentioned gummies. Gummies happen to be the most popular form of edible cannabis in the world. That's what most people go to. I don't know why. I don't like gummies myself. I prefer chocolate bars. But they are the most popular form. And so we can't sort of arbitrarily restrict them because of some fear that people are going to be irresponsible and they're going to end up in the hands of children.
Okay, let's get to our next question.
My name's Josie. I have struggled with mental health issues for most of my teen years. I started smoking weed at 14, and by 15, I was a full-blown pothead. I consider myself to be a marijuana addict, and I'm getting treatment for it right now. I will take a dark roast, please. The symptoms that I struggled with were intense paranoia, auditory hallucinations, and sometimes visual hallucinations. I received treatment for it, and I no longer struggle with psychosis, but I do struggle with cannabis addiction. I would tell other young people in Canadian to respect marijuana as a mind-altering substance, not to demonize cannabis use, but to do it responsibly if they are going to do it underage. Please keep in mind that your brain has not finished developing and that you could have negative effects.
What is the question that you'd like to ask?
My question is, what do we have in place to address marijuana addiction after legalization, especially for youth? And there's not a lot of research to show what the long-term impact of regular cannabis uses, especially among young brains. And I was wondering what the government has planned to address this issue.
So sounds like a question first and foremost for you, Minister Blair. Alcohol, pretty easy for teens to get a hold of, despite the regulation in place. I think, quite frankly, it's easy to get cannabis as well. Is that just going to get worse?
And I'm very hopeful that it will not. First of all, I want to thank Josie for her question. I think your testimony is compelling. And I would like every young person to hear the caution that you offer from your lived experience, because I think young people have to know that this drug is not necessarily benign and that there are significant risks, particularly the younger onset of use. But it's very important to understand, Andrew, that we're not merely legalizing cannabis. We're implementing a very strict and comprehensive system of regulation that'll control every aspect of its production, distribution, and consumption.
But a system that already exists in terms of alcohol, and yet we have a problem.
Well, we do have a problem, but one of the challenges with cannabis, Josie mentioned the lack of research. In a criminal prohibitive environment, research has been very, very challenging, if not impossible, in a lot of jurisdictions, simply because how do you do longitudinal tests or clinical trials in an environment where you're talking about an illegal substance? And so it's only in a regulated environment that research can now begin to take place. We also recognize, and our government has said, the revenue that is generated from the excise sales, the excise tax of cannabis, needs to be reinvested in research, prevention, treatment, and rehabilitation.
But help me to understand exactly what you're saying here, because are you saying that the bulk of the meaningful research can't really happen until regulation happens, and no, so therefore between
first of all, there has been a great deal of research, but in a regulated environment, I think that creates a new environment for research that will be far more effective and allow us to learn more about the use and misuse of this substance.
If I could ask you then, at this point, do you expect marijuana use, overuse, and addiction to get markedly worse?
My very sincere hope is that through making it more difficult for young people to access this drug, by displacing the illicit market, which will take time, but that's very much part of what we're trying to achieve, through public education to inform young people, but also their parents, their teachers, and their health professionals more about the social and health risks of cannabis.
But we all hope that. I think we're all on the same
Andrew,
page.
Right now, under the criminal sanction, we have the highest rates of cannabis use among our kids of any developed country in the world. And we just have to do better. And it is my very sincere hope that through education and through effective regulation, as opposed to ineffective criminal prohibition, we can actually reduce the incidence of cannabis use among young people.
Is what you're hearing here, does that resonate for you? I mean, is this the start of an answer for you?
When I was smoking weed in high school, there was no legal weed smoking age. Right. So there was no, this is how to do it responsibly. So there was a lot of misuse, and I see it among my friends as well, that there's a lot of marijuana misuse. I don't think marijuana should be demonized, but I do think that people should have as much information about marijuana, especially if you're under 25, on how marijuana can impact you. And I hope that there is an education plan in place, maybe in schools, to say, oh, marijuana is impacting your school life, or you're overly paranoid to the point of psychosis. Who am I going to talk to? And is it okay to say, hey, marijuana is not right for me?
Dr. Osler, clear the air a bit for us. What do we know about the long-term health impacts of cannabis use, particularly on young people?
Well, Josie's talked about the age of 25, and we know brain development continues up until the age of 25. And we also know that the younger cannabis use starts, the more frequent the use, the type of product is being used, can have an effect on that developing brain. And so again, I think it's an important message coming from a peer and not just from a doctor. And personally, I'm heartened to hear from Minister Blair that more resources will be put into counseling and addiction services. I think it's vitally important to have that in place as a promise to Canadians.
Josie, thank you.
Thank you so much
for your question. Moving on, this is Sam.
I'm Sam Znaimer, and I'm an investment professional. I received a lifetime ban preventing me from entering the U.S. due to some investments in U.S. cannabis companies. More recently, I've read interviews with U.S. Homeland Security officials suggesting that Canadians who invest in Canadian companies only operating in this country, or employees of those companies, or people involved in the industry, however indirectly, might also be subject to bans. What I want to know is what happens to Canadians traveling to the U.S. after cannabis legalization?
And boy, that's a big question, Minister Blair. I think this one's for you. I mean, 20 million Canadians visited the U.S. last year. Even going from A to B, where in Canada, cannabis will be legal, you may be going to a state where cannabis is legal. What's the issue at the border?
First of all, it's very important for every Canadian to understand that notwithstanding we'll have a new legalized, regulated environment in Canada, it will be a serious offense, a criminal offense, to carry any amount of cannabis into the United States or any other country, and conversely, to bring it from any other country into Canada. What we have heard from the Americans, we've had quite a number of discussions with them, is that for them, they're not changing the way in which they manage the security at their border. And so if you indicate to the border agents that you are either carrying cannabis or going down into the United States to engage in a business that is illegal in their country, then it's very likely that they will exclude you from entering the country.
And Kirk, I mean, this is an issue that entails serious risk, as Minister Blair is suggesting here. I mean, if a border agent asks you that very question, do you have cannabis on you? Do you consume cannabis? What are you supposed to say?
Well, yeah, this is an important issue, and not just for investors, for consumers as well, because the United States can ban you for life for being a drug consumer. And so it's, you know, there's a small subset of Canadians that have investments in the cannabis industry, but there's a much larger group of Canadians that have consumed cannabis. So what do you do when you get to the border? Number one, you don't lie to a U.S. border agent. If you lie to a U.S. border agent, you're looking at a 5-year felony. I've actually defended those cases in the United States when I practiced there in the early 2000s. Don't do that. But similarly, you don't have to answer their questions. Right? You do not have to incriminate yourself, and you should not incriminate yourself.
But if you don't answer the question, they may turn you around.
They may turn you away. But if you answer the question truthfully, they may very well ban you for life. And so you're in a delicate situation, and it's really up to the discretion of the individual border guard what's going to happen. But it is an issue that requires a diplomatic solution. We can't tell them what to do at their border, but as their largest trading partner, as you know, 2/3 of our population goes to the United States every year, I think they need to make some concessions to the fact that we are a sovereign nation. We have decided to legalize this, and simply because they're behind the times, we shouldn't be penalized.
I want to stay on this point of law and order, but perhaps with a slightly more sensitive question, I would say. Take a look.
Hi, my name is Malik Scott. Last year, I was arrested for marijuana possession. I believe that racial profiling had a huge part in that. The first time I was arrested, I was in a parking lot, and all of a sudden I see a cop car, and for some reason I got this strange feeling, and I decided to leave the parking lot. So as I'm leaving, they park right in front of me and kind of box me in. It was put on me time and time again that I had marijuana on me when I didn't, and I was taken into the police station for that. After that, the case was dropped. The second time, same song and dance as last time. I ended up getting pulled into the station. Again, they found nothing on me, and I was sent on my way.
Hi, Malik. What's your question?
So with this future legalization coming up, I'm wondering how exactly will it affect racial profiling in policing? Also, the people who've been convicted and even incarcerated for cannabis use or dealing, what have you, will they receive any amnesty when it is legalized?
Racial profiling is abhorrent, unacceptable, and unlawful. It's unlawful in Canada. It's contrary to the Canadian Human Rights Act. It's contrary to our Charter of Rights and Freedoms. And so any individual and any police officer engaging in racial profiling is breaking the law.
And would you concede that it has been a problem?
Oh, I conceded many, many years ago. If you don't acknowledge its existence, you can't do anything about it. We've worked awfully hard to actually address some of those concerns.
And so how does legalization change the equation?
Well, I think it's important to acknowledge that the enforcement of cannabis laws in Canada has had a disproportionate effect on minority communities, racialized communities, young black men, Indigenous, mostly young males, but also all Indigenous people, poorer communities. There has been a disproportionate and therefore unjust impact on many communities. And our government's made it very clear, starting on the 17th of October, when the law is repealed and replaced, it gives us an opportunity to take a look at those convictions that some people have for simple possession of cannabis and deal with those in the appropriate way at the appropriate time.
But why couldn't that have been done concurrently with all of the planning to establish this regulatory framework?
Simply because you cannot nullify the law. Until the repeal and place takes place, the law remains in effect. It's the only system of cannabis control that currently exists. And
but could this not all have unfolded very quickly? I mean, let me ask it a different way. What is it that
many people are suggesting we're going too fast, but quite frankly, we've been very cautious and careful as we've approached these new regulations. On October 17th, that takes effect. And from that moment on, we stop criminalizing those kids for criminal possession of cannabis, and it also gives us an opportunity after to deal more appropriately with those existing records, and that's our intent.
Do you believe that there'll be any amnesty given to the people already incarcerated and have had their time taken from them?
Malik, the law that existed was upheld and enforced. It's been tested in our courts and found to be constitutional. But we believe that the impact of those criminal records is disproportionate to the offense. And we know that it's been disproportionately impactful on certain communities, and we want to fix that. And so we're changing the law, and we'll deal with those records. But the charges that were laid in the past were done under the law as it then existed. And once we've changed that law, then we'll be able to deal with those records.
Kirk, you're sort of nodding your head as you listen.
Yeah, Andrew. I mean, this may be a rare moment, so capture it on film, but I almost agree with everything that Minister Blair has said in the last few minutes. So
let me rethink
cannabis really does bring people. Cannabis really does bring people together. Look, I think where I differ is that the Minister of Justice could have, in 2015, discontinued prosecuting people for simple possession. The Crown Prosecutor's Office has a duty to determine before they bring charges whether or not it's in the public interest to do so. I think we heard Minister Blair say that it's not in the public interest necessarily to prosecute people for simple possession. So that could have been done. It wasn't. I understand that. Sometimes policy and politics don't go hand in hand. Let's look forward. In legal jurisdictions where cannabis has been legalized, where possession of cannabis has been legalized, you've seen tremendous drops in enforcement. You've seen something like 90 to 95% drops in enforcement of the cannabis laws. And so I think we're going to see it get better. I find it somewhat unfortunate that the Cannabis Act continues to take a criminal law-based approach with exemptions. I'm looking forward to Legalization 2.0 when we can move beyond a criminal law-based approach and have a truly regulatory-only approach. And I think we'll get there. I hope we get there soon.
We do want to show you another figure first from our CBC poll, which is at the heart of so many of these questions, including this one. According to our numbers, more than half of Canadians, 55%, don't believe that government is ready for legalization. And one of the gray areas, it seems, is how this will affect Indigenous communities and the right to self-govern.
Bonjour, Anin. My name is Rob Stevenson. I'm from Alderville First Nation. I'm an Anishinaabe man. The medicine wheel encompasses pretty much everything to do with life, about helping people. I saw a real niche or a need to be able to use cannabis in a way to benefit people. I've used cannabis for a long time myself for my anxiety, so I know how it can be helpful. As an Indigenous person, on sovereign land, I feel we have a right to be able to use this natural plant to be able to benefit others. And I feel as long as we're using it in a good way, giving back in a good way, and not just focused on profit, I feel like we do have a place in this industry. And so I'm, trying to make our mark within the Indigenous cannabis industry. It should be up to each individual reserve if they want to be involved in the industry or not, and then it should be up to each individual reserve on how they want to be involved in that industry, because dynamics are different from reserve to reserve. Miigwech.
Robert Stevenson joining us now. Robert, hi there. What's your question?
Yes, Miigwech. My name is Rob Stevenson. I'm president of the Ontario Indigenous Medical Cannabis Association, spokesperson for the Mississaugas of Rice Lake Cannabis Association, and I own one of the largest Indigenous dispensaries in Alderville First Nation called Medicine Wheel Natural Healing. So my question today is more directed at Minister Blair here is, will the government respect Indigenous people's constitutional rights to self-regulate the cannabis industry within our own territories?
Minister Blair,
yeah,
you're the man of the hour.
Yeah, it's an important discussion, and we've been very much engaged with First Nations across the country on this discussion. We've heard from many, not all, but many First Nations communities, just as you mentioned, of a number of different communities and nations who wish very much to have an opportunity to participate in the new nascent industry of both production and distribution of cannabis. And so we've actually, within Health Canada, we've gone out and hired a navigator. We've been working very closely. We actually approved just last week the first licensed producer, which will be based right directly upon one of the First Nations in Akwesasne. Here in Ontario, we acknowledge and respect the jurisdiction of First Nations, and cannabis taxation and excise are all part of that larger discussion about revenue and taxation with First Nations.
Correct me if I'm wrong, though, and I don't want to put words in your mouth. I mean, but it seemed like a key part of the question was self-governance, self-regulation. You've talked a bit about granting approvals. I'm not sure if you've answered the question.
We have been meeting with the national organizations, the AFN. I appeared before the Special Assembly and spent 3 hours answering questions on this very issue there. We understand the complexity of the exercise of jurisdiction over both production and retail and consumption regulations on those jurisdictions. And we've been working with First Nations across the country. It's a complex issue. And I apologize if my answer is less than precise, but I'm trying to be respectful of that complexity. But I want to also assure the First Nations of Canada that we do very much acknowledge and respect their jurisdiction and desire very strongly to work with them to assist. We have a shared goal. We all want to protect our kids. We want to displace that illicit market, and we want to support the First Nations communities in the fulfillment of their jurisdiction and their aspirations.
We have another question. Watch this.
Hi, my name is John Davila. I was diagnosed with epilepsy in 2014 and suffered 12 grand mal seizures in an 8-month period. Not finding any relief from prescription medications, I decided to go and try cannabis. And since then, I have been seizure-free for 3.5 years using my local Vancouver dispensary sold cannabis. And my question is, will I be penalized for seeking out other sources after legalization so that I may be able to continue to take my current regimen of cannabis products and brands which will be considered illegal after October the 17th?
What I'd actually like to do here is pivot this question to you, Dr. Osler, because one of the parts of his question has to do with his situation, which is that he can't get a particular strain of his marijuana under the new legalized framework, that it's not available in the legalized marketplace. In a case like that, what are his options?
So one of the earlier discussions that we had was the research. And I think you've heard all of us talk about the research that's available and how after legalization of cannabis, this will and can open up new research on different forms of cannabis for use for different medical conditions. And so I've been on record as saying this is an opportunity for more of the high quality research that doctors have been asking for to see the effects and benefits potentially for cannabis in different medical conditions.
So Mr. Blair, I want to tackle the other part of his question, which was about cost. And correct me if I'm wrong, but the price of medical marijuana is increasing under this new legalized framework because medical and recreational marijuana are going to be taxed the exact same way. How do you avoid pricing people out of this new world order, especially people who rely on medical marijuana?
It's important to understand that medical marijuana under the current regulations is obtained from licensed producers directly from the licensed producer to the consumer. The excise tax that is being imposed and the sales tax that are imposed upon the producers. Frankly, their profit margin in selling to their medical patients is significantly higher than selling it at a wholesale price at the provincial level. The reason that we believe it's appropriate to maintain a standardized taxation framework for all cannabis products is to maintain the integrity of both systems and not to influence consumer decisions based on the taxation levels. Cannabis will be competitive in price. It's taxed at exactly the same level as what will be available in the regulated recreational market. And we are working with the licensed producers to ensure that the issues of choice, access, and quality are also being appropriately addressed.
We do have one final question that I want to get to. Have a look at this.
So I did work in the pharmaceutical industry as a chemist for several years. And eventually when I became a patient, I just saw the need. So I made the switch over. I opened up a dispensary to make patient accessibility greater. It was, to serve patients who can't purchase online. Eventually, it just sort of became my passion as I started working with patients. I got to know a lot of their struggles and like how hard it was for them to acquire a prescription or any information on, how to use cannabis.
Tanya joins us now. Hi there. What's your question?
So my question is, will there be a fee structure for small local dispensaries versus large corporations for licensing?
Minister Blair, how would you respond
the license
to that question?
for any retail outlet will be determined by the provincial jurisdiction. Right. So we have 10 provinces and 3 territories that will each have a different framework for the licensing of their retail outlets. That'll be determined by them and whatever fees they charge. I also understand there are some jurisdictions where the municipalities are also imposing business licensing fees, and that's very predominant in British Columbia. So that's not a federal issue. The federal government is not regulating or licensing the retail environment. That's entirely a provincial jurisdiction, and each of them is adopting a different approach.
But I mean, just that fact, though, that it has been downloaded as a responsibility to the provinces instead of there being one sort of uniform structure.
Andrew, I find it interesting because I hear people use the term download. It's simply an acknowledgement. That's their jurisdiction. It's a respect that that's their jurisdiction. They have the authority to do that. And quite frankly, as I've traveled across the country, what I have discovered is that there are very different contexts and different experiences on the sale of alcohol, for example, and the different retail environments that exist in different parts of this country. And simply by acknowledging and respecting the jurisdiction of the provinces and territories to establish rules that are appropriate for their constituents, I think is the right way to go. That's the approach that we've taken. I will tell you that British Columbia's approach to this is very different than Prince Edward Island. And so a one-size-fits-all imposed from Ottawa regulatory framework for distribution, I think would have been inappropriate. And the right way to do this was to acknowledge that that's a provincial authority, respect their authority, and work with them. My only concern is that they do a good job of making sure the kids don't have ready access to this, and they displace that illicit market, because we want a regulatory environment for retail that follows rules, is subject to oversight and accountability to protect the public interest.
Let me say, this has been a fascinating conversation. Thank you to all of our questioners for sharing their thoughts, their concerns. Thank you to our panelists as well. Truly appreciate all 3 of you taking the time to be here with us today and to answer all of these questions. We will, of course, be following this story over the next few days leading up to legalization, and of course in the days and the weeks and the months to come. Thank you so much for watching. Take care.